Hello everyone and welcome back. This is question 13 of our 100 clinically oriented anatomy questions. Let's get straight into the video. It says a 72-year-old woman is admitted to the hospital with a painful right foot. A CT scan examination reveals a thrombotic occlusion of the femoral artery in the proximal part of the adductor canal. Which artery will most likely provide blood supply to the leg through the genicular anastomosis? Option A is the medial circumflex femoral artery. Option B is the descending branch of the lateral circumflex femoral. The first perforating branch of the deep femoral, the inferior gluteal, and the descending genicular branch of the femoral artery. So let's go back to the question and see the important information the question gave us. We've outlined the things we need to focus on. Thrombotic occlusion of the femoral artery in the proximal aspect of the adductor canal. So thrombotic occlusion basically has to do with the blockade of the femoral artery in the said position. So they also mentioned the genicular anastomosis. So the genicular anastomosis is an anastomosis that actually happens in the knee region that provides a collateral blood supply to the knee region and the leg generally. So let's go to the options and talk about them one after the other. Option A, the medial circumflex femoral artery. The medial circumflex femoral artery is the major artery that supplies blood to the head and the neck of the femur. That is the basic thing it does, and it gives an ascending branch that takes part in the formation of the trochanteric anastomosis. It also gives a transverse branch that takes part in the formation of the cruciate anastomosis. So it does not give any blood and does not give any branch to the genicular anastomosis. Option B, the descending branch of the lateral circumflex femoral artery. So let's discuss the lateral circumflex femoral artery. Lateral circumflex femoral artery branches off laterally from the femoral artery. It gives us three branches: the ascending branch, the transverse branch, and the descending branch. So the ascending branch takes part in the formation of the trochanteric anastomosis. The transverse branch takes part in the formation of the cruciate anastomosis, while the descending branch, that is the set descending branch here, takes part in the formation of the genicular anastomosis. And it is the correct answer to the question here. So it is the artery that provides blood supply to the leg through the genicular anastomosis, because the lateral circumflex femoral artery gives a descending branch that takes part in the formation of the genicular anastomosis. The descending branch of the lateral circumflex femoral artery anastomose with the superior lateral genicular artery, right? So yeah, that is one of the arteries that form the genicular anastomosis around the knee region. So the ascending branch of the lateral circumflex forms the trochanteric, like I mentioned. So the trochanteric anastomosis now, the trochanteric anastomosis is formed by the coming together of four arteries: the ascending branch of the lateral circumflex femoral artery, the ascending branch of the medial circumflex femoral artery, the descending branch of the superior gluteal artery, and the descending branch of the inferior gluteal artery. So those are the four arteries that form the trochanteric anastomosis. I'll come again: the ascending branch of the lateral circumflex femoral, the ascending branch of the medial circumflex femoral, the descending branch of the superior gluteal, and the descending branch of the inferior gluteal. Those are the four arteries that form the trochanteric anastomosis. Now, the cruciate anastomosis is formed by four arteries also: the transverse branch of the lateral circumflex femoral, the transverse branch of the medial circumflex femoral, the ascending branch of the first perforating artery, and the descending branch of the inferior gluteal artery. So those are the four arteries that form the cruciate anastomosis. Option C, the first perforating branch of the deep femoral artery. So the deep femoral artery is also called the profunda femoris artery, and it is the largest branch of the femoral artery. It supplies blood to the thigh, basically. It is the major artery that supplies blood to the thigh. So it gives off three perforating branches, right? While the terminating part of the profunda femoris now acts or forms the fourth perforating branch. So there are four perforating arteries, three branches up directly from the profunda femoris artery, and the fourth perforating artery is formed by the terminating part of the profunda femoris artery itself. So all those arteries actually come together to form the longitudinal arterial anastomosis around the thigh. So that's what it does. It does not take part in the formation of the genicular anastomosis. So the inferior gluteal artery. The inferior gluteal artery gives branches to the cruciate anastomosis and the trochanteric anastomosis. That is, the descending branch of the inferior gluteal takes part in both the trochanteric and the cruciate anastomosis. It does not take part in the genicular anastomosis around the knee. The descending genicular branch of the femoral artery. So the descending genicular branch of the femoral artery is a branch of the femoral artery at the point of exit of the adductor canal, when the femoral artery is almost exiting the adductor canal to enter the adductor hiatus, that is when it gives off the descending genicular branch that actually takes part in the formation of genicular anastomosis. Yes, the descending genicular branch of femoral artery takes part in the formation of the genicular anastomosis, but it is not the correct answer here. Why is that? It is because if the femoral artery is already occluded in the proximal part of the adductor canal, that is before it gives off the descending genicular branch. It means that the descending genicular branch will also be affected in this case. The femoral artery is the one that branches off to give the descending genicular, right? So now, before the femoral artery gives the descending genicular, it has already been affected, it has already been occluded. Do you get? So the descending genicular branch will also be affected in this case. So that is why the descending genicular branch is not the correct answer, even though it also forms the genicular anastomosis. So let's talk about the genicular anastomosis a bit now. So here is the genicular anastomosis. I have written it down here, so it will be easy. The first one is the superior medial genicular artery anastomoses with the descending genicular branch of the femoral artery and the inferior medial genicular artery. The inferior medial genicular artery anastomoses with the superior medial genicular artery and the saphenous artery, which is a branch of the descending genicular artery. The descending genicular artery actually gives us two branches, the articular branch and the saphenous branch. So the articular branch anastomoses with the superior medial genicular, that is this one that they are talking about here, the descending genicular. That's the articular branch of the descending genicular, to be more specific. And then the saphenous artery, which is a branch of the descending genicular, also anastomoses the inferior medial genicular. Now, the superior lateral genicular anastomoses the descending branch of the lateral circumflex femoral, um, which is what the question is asking us. This right here is what the question is asking us. So the inferior lateral genicular also. The fourth one, the inferior lateral genicular artery anastomoses with the superior lateral genicular artery, the anterior and posterior recurrent branches of the anterior tibial artery, and the circumflex fibular branch of the posterior tibial artery. So these are the arteries that make up the genicular anastomosis around the knee. Right. A proper way to understand and retain this is, first of all, we have four genicular arteries that take part. There are five genicular arteries. There is the superior medial and the superior lateral. There is the inferior medial and the inferior lateral. Then there is now the middle genicular artery. The middle genicular artery does not take part in the formation of the genicular anastomosis. The middle genicular artery pierces the oblique popliteal ligament to supply the knee joints, to supply the intrinsic ligaments of the knee joint. That is what the middle genicular artery does. So now, the proper way to understand or to retain this info is, now you have four genicular arteries that take part in the formation of this anastomosis: the superior medial, the inferior medial, the superior lateral, and the inferior lateral. So the superior medial now anastomoses with the inferior medial also. Then it also anastomoses with the descending genicular branch. That is the articular branch of the descending genicular artery. That is it. The inferior medial also anastomoses with that same superior medial, and then also anastomoses with the saphenous branch of the descending genicular artery. That is all for the medial aspect. So the superior medial anastomoses with the inferior medial and with the articular branch of the descending genicular artery. The inferior medial anastomoses with the superior medial and the saphenous branch of the descending genicular artery. That is it for the medial aspect. The lateral aspects now, you have the superior lateral and the inferior lateral. The superior lateral anastomoses with the inferior lateral. Then also anastomoses with the descending genicular branch of the lateral circumflex femoral artery, all right, or the descending branch of the lateral circumflex femoral artery. The inferior lateral now, inferior lateral is the one I can say has the most anastomosis here. So the inferior lateral anastomoses with the superior lateral, then now anastomoses with the anterior and posterior recurrent branches of the anterior tibial artery, and then the circumflex fibular branch of the posterior tibial artery. So that is the anastomosis around the knee joint. It is actually not complex. Just try to understand and um, internalize it. So that is it on the genicular anastomosis. So going by everything we've discussed all along, so it is safe to say the correct answer to this question is the descending branch of the lateral circumflex femoral artery. And I want to believe we are all cleared on that and we understand why the others are wrong. Thank you very much for staying, and I'll see you in the next episode. Bye.